Perfect. Welcome, everyone. Welcome, and thank you so much for joining us for another Brunch and Learn brought to you by The Qualified. Today, I am super excited to have everyone here with us. I'm your host, Japera Denson, and I have the pleasure of inviting Miss Trivia Kimbrough with us today to be our phenomenal speaker. She's going to talk to us about inpatient versus outpatient coding and give us the ins and outs on inpatient and outpatient coding. Again, we have some people who are joining us even now, but we want to welcome you and we hope everyone feels comfortable and ready to go for today. Just before we get started, however, I want to give us a little bit of information about the Qualified. Just to remind you what we're here for. First of all, we're here to provide you, those of you who are already credentialed and have some type of certification in your pocket, we are here to provide you with continuing education units so that you can keep those certifications alive and keep them going. If you are needing credentials, or if you want to become certified, or if you want to get some type of new coding credential or HIM credential of some sort, be it with AAPC or a HEMA, we are here for you. Even HIMS, we can help you with that as well. So if you want to become qualified, we want you to contact us. And then if you have if you are an employer and you need to hire some qualified or certified or credentialed people, we want to help you connect and get the people into your departments and into your organizations who can serve you best. So we have a little bit of something for everybody, right? A little bit of something for everybody. And so that's good because we're all here to service our health information management community and professionals and make sure that you all have what you need to have a thriving career. So again, welcome to those who are joining us right now, who didn't hear the initial welcome. We're so glad that you all are here. We're going to go ahead and turn it over to our presenter for today. So ladies and gentlemen, please, without further ado, let us welcome Ms. Trivia Kimbrough talking to us about inpatient and outpatient coding.
Hello, everybody. It's great to be here. Good afternoon, good morning to some of those, and good afternoon to everyone else. With the Eastern time and Central time and Mountain time, it's different everywhere, but we're glad you're here. Today, I'm going to speak to you on inpatient versus outpatient coding. For some, this is new. For others, you want to just know what's going on. But before I do that, I want to say thank you to Japera, thank you to Julia, and thank you to Dr. Savory for giving me this opportunity to speak with you today on inpatient versus outpatient coding. Next slide. So this is me. I have been coding for over 20 years. From the outpatient is where I started, outpatient coding, to inpatient coding. I just received my CPB probably a month or so ago, which is the Certified Professional Billing certification. I have my CPC, the Certified Professional certification, the CPCI, which I'm an instructor, and the CCS and ICD-10 PCS trainer from AHIMA. So I have coding certifications on both sides and experience on both sides as well. I currently work for Advent Health Hospital as an inpatient coder, and I totally love it. I feel like it's the best hospital I've ever worked for, and I've been working in coding, of course, for over 20 years. So that's like a big accolade for me to say that this is the best hospital that I worked for thus far. I teach others about medical coding at Kimbrough Learning Institute, which is my company, while working with other organizations such as the Qualified and other instructors to help students succeed, which is the ultimate and main goal. I continue to earn my CEUs through the Brandon AAPC chapter and the Gulf Coast Health Information Management Association. And I continue to support both boards because, if you wanted to grow and be better for the younger crowd or for those that are coming in, you got to support the boards as well. Some of my hobbies including reading, playing board games, hanging out with other married couples, and I have single friends as well, but I do hang out with a lot of married couples and working out and vacationing with my family. I love to vacation. I think I love that more than working, but hey, we all have to work. Next slide. This presentation aims to explain the fundamental differences between inpatient and outpatient coding. So as medical coding professionals, it is crucial to understand these distinctions. So we're going to talk about understanding where you want to start, understand how the certifications, or what certifications you should explore or acquire. And then we're going to talk about understanding where to locate the average salary. Next slide. The objectives is what is outpatient versus inpatient coding. We're going to talk about the different certifications on both the AAPC side and the HEMA side. The main coding books that will help you to prepare for any exam. And also continuing education units that we have to keep the certification. We'll also talk about some of the membership costs, because there are membership costs that are due yearly on both sides, average salary, and then what does the transition from outpatient versus inpatient coding look like. Next slide. So here's the outpatient versus inpatient coding. The outpatient coding is documented from a medical record in the outpatient service. It's mostly those services that include anything where the patient does not have to stay in the hospital over 24 hours. The outpatient service can include, but is not limited to, the physician office. It could be considered ambulatory surgery center, the emergency department, ancillary coding for departments such as your lab and your radiology, your ultrasound, the when you go to things like Quest Diagnostic or you go to Tower Radiology, those are places that are considered outpatient settings. The typical length of stay is 1 day. Typically, patients come into the office for an hour or less. So when you stay more than 24 hours, or more than 2 days, that's when we go into the inpatient coding side. The inpatient coding is documented from the medical record of a patient that is admitted into the hospital. And these accounts can range from an inpatient stay from 2 days or until 30 or more days. Yes, as you know, when we had COVID out here, a lot of patients were in the hospital for long durations of time before they figured out the different type of antibodies and other things that could help that virus. So yes, we had patients that were in the hospital for more than 30 days. I think to document, now I have coded a chart that was close to 60 days where a patient was sick. So it can happen. Inpatient coding is more in depth because you're coding each day for that patient. Next slide. So here are some certifications for a HEMA coding. A HEMA has a variety of certifications that they could either work in the outpatient or the inpatient field. Technically, you can be hired with any of these certifications on the HEMA side. The certified coding specialist, the physician base is just meaning that it is physician coding only. So it's probably pretty much like the E&Ms in the doctor's office. So you'll do a lot of E&M coding plus the minor procedures that are actually done in the office. This could be vaccinations. It could also be ultrasound or EKG inside the doctor's office if the physician owns that equipment. Or you can get a certification that's inpatient or outpatient that includes the Certified Coding Associate or CCA, Certified Coding Specialist, CCS, Certified Documentation Integrity Practitioner. They a lot of them call it the CDIP or CDIP. Certified Health Data Analysis, certified in the healthcare privacy and security. And then of course we have the RHIA and the RHIT, which is the Registered Health Information Administrator or the Registered Health Information Technician. These two go back just 1 minute. The registered health information administrator and that registered health information technician, those certifications are typically certifications that you will have to do some college work before you can study and take that test to be proficient into being certified. Next slide. So here's a little bit descriptions on a few of these. The CCSP, the Certified Coding Specialist Physician Base. These are professionals that perform coding in physician offices, group practices, multi-specialty clinics, or specialty centers. The CCSP certification exam assesses the mastery level proficiency in coding of health services delivered or delivery beyond the hospital setting. So typically this type of coding is not done in the hospital. This is more for this certification is typically those in the physician office, a multi-specialty clinic, which means they could have the internal medicine, they can have an orthopedic, they can have a cardiologist in one clinic. That's what we call multi-specialty clinics, or it could just be it could be a specialty center. So those would be more like your specialty centers for like cardiology, and they might have like 5-6 doctors of cardiology and any equipment that they can bill for on an outpatient basis. So that's what we call the specialty centers. The certified coding associate, these are coding professionals who hold the CCA credential that have demonstrated the coding competency across all settings, including hospitals and physician practices. Now, since 2002, the CCA certification has been a nationally recognized standard of achievement in the health information management field. The CCS certified coding specialists are skilled in classifying medical data from the patient's records, often in a hospital setting, but also in a variety of other healthcare settings. The CCS credential demonstrates a practitioner's test skills in data quality and accuracy, as well as mastery of coding proficiency. Now, the CCS certification is a natural progression for professionals that are experienced in coding inpatient and outpatient records. They also create coding data or coded data used by hospitals and medical providers to obtain reimbursement from insurance companies or the government programs such as Medicare and Medicaid. Researchers and public health officials also use this data to monitor the patterns and explore the new interventions. Now, remember, with the CCS, you can work on the outpatient and the inpatient side when it comes to coding as a HEMA certification. So now we go to a little bit with the AAPC side. AAPC has certification for outpatient and inpatient. Now, AAPC's outpatient is more in depth by specialties. And the reason I said that is because the CPC is kind of like their basic certification, or not even really basic, but it's like the main one. If you're going to have a main certification from AAPC, you want the CPC. If you want the main certification from a HEMA, you want the CCS certification. But on the outpatient side, they have a vast majority. And of course, I am not going to go through these because it is so many and they keep adding on more and more certifications. But what you can see is they have like the certified documentation expert outpatient. They have the ambulatory surgery center coder. They have someone who wants to just specifically code anesthesia and pain management. You can do that. Or you can be a cardiology coder. Would I say go out and get a bunch of certifications? Yes, it looks great on your resume, but don't go out and get a bunch of outpatient certifications if you're not going to use them, because as you get certifications, your CEU requirements increase as well. Next slide. Also more certifications on the outpatient coding side. as you can see, it's still in depth. You can do evaluation and management. You can do the general surgery coding. You can do the interventional radiology cardiovascular coding, which is the CIRCC. And a lot of people try to get that certification, but it's dealing with a lot of the heart and the vascular areas of the body. Dermatology is one. They have a pediatric coder. They have rheumatology, and it consistently goes on. Next slide. So the certifications for inpatient coding on the AAPC is not as vast or as in-depth as AHIMA. AHIMA has a very in-depth certification. So when it comes to AAPC, the inpatients that most people use or utilize to, find a career is the certified inpatient coder, which is CIC, the certified documentation expert inpatient, and then the certified risk adjustment coder. And risk adjustment has just like really blown up the last couple of years, but it also helps to save money for the doctor's offices, to keep them, out of trouble with other insurance companies, but to allow them to see if they could be getting more money in the physician's office as well, and the hospitals, because it works for both sides. So with the AHIMA study material for outpatient and inpatient certification, typically when you take a test with AHIMA, you're going to look to do the ICD-10 CM code book, which is the diagnosis, the ICD-10 PCS code book, which is the procedures that are performed in inpatient, and the CPT 20, well, I put 2023 on here, the CPT and the CPT E&M companion. Now, when you look at these books, typically you're not going to use all three books in one setting. If you're working for the hospital, you're going to use the ICD-10 CM code book and the ICD-10 PCS code book. If you're working for an office setting or ambulatory surgery or something to that extent, then you're going to do the ICD-10 CM code book and you're going to do the CPT book. So the common denominator is you're going to always use the ICD-10 CM book because it's the diagnosis part of coding. But depending on where you're working, you'll use either the ICD-10 PCS book or you'll use the CPT code book. AAPC, as you can see, the books are very similar. So the same thing. The only difference with the AAPC material, they do have an ICD-10 PCS book. And I think that might be on my next slide, but that's fine. But with the outpatient, it's the ICD-10 CM book, the CPT book, and the HCPCS book. The HCPCS book is used for dual medical equipment. So if a patient needs any type of home care, they need a wheelchair, they need, the portable potties or toilets for the home, they need walkers, they need shower equipment to take a shower. That's where we code with the HCPCS. The HCPCS book is also for when we code for injections, and we have to code the medications that we're giving. So you will find the medication for the injections inside the HCPCS book. Any medications that are given to the patient in an outpatient setting. Do they use the HCPCS codes for inpatient? Absolutely, they do. But as an inpatient coder, typically you don't code that. That is something that comes in from the charge master, which is inside of hospitals for inpatient. For the AAPC side, remember the same books. You have the ICD-10 CM, the CPT books, the HCPCS book, and the ICD-10 PCS books. And usually with AAPC, they give you free CEUs, but on the HEMO side, they give you free CEUs as well. Next. So let's talk about continuing education units requirements. Now, these are the requirements to maintain your certification. How many certifications have you obtained? The more certifications you get, the more the increase in the CEUs. The type of certification that you have obtained has a certain amount. With my CPC, I think I have to have 26 CEUs every 2 years. With my CPB, I have not checked to see how many CEUs you have to do, but you have a 2-year time span on AHEMA and on AAPC side to get your CEUs. The good thing about CEUs is there are a lot of companies out here that offer free CEUs, and you can just, you know, once you see a free CEU out there, if you sign up with your email address, they will start sending you emails about these CEUs. Now, can I pay for CEUs if I wanted to and my time was crunching? Absolutely. There are also companies that will allow you to pay to watch a video, to take a test, and to get the CEU. I know with the qualified, you can get CEUs as well. And it's always a great opportunity to have, you know, a company like this that would allow you to get CEUs or will help you to find CEUs if you need it. The good thing about this, and I try to tell everybody, is every month work on you a few CEUs if you can. Whether you are signing up for it and you're using your lunch break to do it, even if you could find the free CEUs, that's even better, because guess what? You could sit on your lunch break and listen to it, do the test when you finish, and have your CEUs, and that will help you to continue your certification, because not only do you have to pay for it, you do have to do the required CEUs every year. And some organizations will charge you if you're late submitting your CEUs. I mean, I think one of the organizations were like $50 if you were late past the time. So try to not do, you know, try to get your CEUs in on time. So membership costs. The membership costs for AAPC's yearly membership. For a student, it's about $140. For members, it's $205. For AHEMA, it depends on the type of membership you get. If you're a student, it's $49. If you're a member, it's $149. But the emeritus is the people who are in a certain age bracket that's trying to get the certification. Then you can get it for $49 as well. So in order to see if you qualify for that, you can always go on the website. The only thing about memberships that a lot of people don't get is memberships go up usually most years. AHEMA is kind of steady. Their membership kind of remains the same. Their requirements kind of remain the same, and I love that. AAPC most times will increase their memberships. I just noticed that their exam fees have increased for this year and will be increasing for next year as well. So you kind of have to watch out for it so you can plan accordingly. I do know that some organizations allow you to do payment plans as well. So let's just say you know it's coming up and you want to get it paid off before it comes, you can do that as well. And I see someone says membership still go up. Yes, they could. Someone said that their AHEMA renewal was $199. So they will go up. I would just say plan for it accordingly. Me, I have AHEMA certification yearly memberships in October, and I have AAPC memberships in February. So usually when I pay my October, I'm already looking to see what I'm have to pay for in February to kind of give myself that time frame. And you know, even if you have to go as far as putting it in your calendar early, you would rather pay the membership costs than have to pay the late fee and the membership costs. So the salary. The average salary depends on a few variables. The experience, like how many years have you been working? And it's not how many years you have been working in coding. Some jobs just want to know if you have the medical experience. It also depends on the state that you're working in. To me, Florida does do good pay, but I have I do look at other LinkedIn's and Indeeds, and I would just look to see what everybody else is making in other areas. What I did notice is like, okay, Florida does good, but California, they make really, really good money. But of course, you have to understand California has a higher cost of living as well. So that kind of plays into it as well. The certification requirements, if they're met or not. One thing you have to understand is when you take your certification, the score is never revealed on the HEMA side or on AAPC side. I always get a little giggle when people are so excited and they like, I got a 80 something on my AAPC side, or I got a 3.0 something on this side. And I'm like, nobody would ever know that, because the only thing jobs really ask you for is your member ID number, and they can go on each organization and figure out if you are certified and when your exam, not your exam, but when your membership is due again, or if you're current. And it also depends on the outpatient versus inpatient side. Outpatient coders make great money. Inpatient coders make great money as well. But inpatient coders do get paid a little more money because of the content that they have to view. The what your productivity is on the outpatient side, it may be 80 charts a day. So that could be 10 charts per hour. On the inpatient side, your productivity could be 19 charts per day. And so that's typically about 2 charts per hour, but you got to understand your date. The amount of time that you work on the chart is going to be longer on the inpatient side than it is on the outpatient side. One of the little tidbits that I like to tell people, the salary averages can be found at the AAPC website. I'm pretty sure that AHEMA probably has this as well, but I just couldn't find it. But for my next presentation, I might be able to locate it. This gives you just the average of what coders make. So this will be a great tool if you want to say, I got my certification, I have my experience, let me go look on this website to see what the average person makes. Just so you will know what ballpark to be in when you go in for an interview. The yearly survey is sent to members with the AAPC every year, and that's how they get that average of what each coder is making, and this helps them to come up with this survey average or salary average to be able to give us that information and assist us on what to look for. All right, so I wanted to give everybody an example of a inpatient order, or what we code from, and the inpatient and outpatient. So here is the outpatient. This is a typical lab order. This would typically be something that you would take to, we'll say, Quest Diagnostic to get blood drawn. As you can see, they'll do the patient's name, the date of birth, and the patient's ID number. It'll typically have the date of the order, the day that they did it, and the labs that are due by, and they'll have a date as well. This kind of allows the lab to know how fast they need to have these results to the physician. Do they always do that? No, but typically that is the goal. The diagnosis, they'll put it, in this case, it was hypothyroidism, which is EO 3.9. And then of course, they'll have the tests that are ordered. Typically, they'll have the insurance information, so it'll be easier for the lab to verify the patient. And then with depending on where you go, if you're going to LabCorp or Quest Diagnostic to get the lab work, there are typically numbers in that area over to the right that will tell you what the codes are to get this test. After that, as you can see where it says cortisol towards the middle bottom and the ACTH, you'll see that those are the tests and the in-depth of the tests that need to be performed, or what the doctor is looking for. And then the provider must sign, and of course, most times it's electronically signed, and then the phone number and the address and the fax number for the physician's office. That's typically what is there. So if as a coder, the thing we would have to sign, like we would have the code number ends for the free T4 and the TSH, which would be part from the CPT book. And then we will enter E03.9 is what the physician is looking for. So outpatient, I say, is simple. Here's a sample of the outpatient radiology order. So the typical same thing, the patient's date of birth, the patient number, the date of the order. In this case was August 7, 2023. The ultrasound or the test order was an ultrasound of the thyroid glands, and the doctor used the diagnosis of EO 4.2, which is the non-toxic multinodule goiter. And then the patient's information, they put that it was due by January 2024. Sometimes doctors do give the patients the orders early and tell them, before you come back for your next appointment, I would love you to get this ultrasound done, and we'll have the results, and we'll speak about the results when you return to the office. That does happen. It makes it faster for the patient. It keeps the patient from consistently going into the office to get results, especially if it's a busy office. Also, they'll have a please fax the results too, and they'll have a number and the physician's signature, which of course is electronically signed during these days most time. And then usually it would be the address, the phone number, and the fax number, just in case there are any questions or any problems that they need to get in touch with their doctor about. Especially if there's an abnormal radiology or lab result, the doctor needs to be contacted immediately when that result populates. Next. Inpatient is a little different, and I tried to put it all on one screen so you can get it. So inpatient coding, this would actually be like a history and physical. So this will probably be like the first, once the patient comes in, either if they're coming directly from the physician's office or if they're coming in from the emergency room. In this case, it looks like this patient came in from an emergency room. So this was a 79-year-old male who presented to the emergency department for hypotension. The patient has a left transcarotid arterial stenting. Today he went to see vascular for follow-up, and he was found to be hypotensive. He was sent to the ED for evaluation. The patient states for 3 days he has been experiencing generalized weakness, dizzy, and nausea, plus shortness of breath, with exertion to the point that he has to sit. Patient does not disclose any other complaints or any other associated symptoms at this time. And so, of course, it'll be the SOAP information, which is the subjective, objective assessment in the plan. But I just went down to show you a little bit of what the assessment looked like. So we, on the inpatient side, will have to code the symptomatic anemia, the generalized weakness, the AFib chronic, the CAD, which is the coronary arteriosclerotic disease, and this patient is status post a CABG. The systolic, CHF, cardiomyopathy, the major depressive disorder, and the pacemaker, because the patient, for the cardiomyopathy, the patient had a pacemaker. The BPH, which is the benign prostatic hypertrophy, the insomnia, COPD, chronic obstructive pulmonary disease, the hyperlipidemia, the diabetes, the carotid artery stenosis bilaterally, and the patient has thinning, and then the obesity class 3, which means it's a morbid obesity. So, and not only that's the assessment, but the plan is they tell you what type of treatment the patient is getting. When you're coding from the inpatient side, you have to code based on if anything was treated or evaluated. So even if they do probable, rule out, and all of that, you can do that on the inpatient side, because the doctor may say it was a possibility the patient has something. He might send the patient to a specialist, a specialty physician, such as a cardiologist, a neurologist, a endocrinologist, or any of those specialties. So even if he says possible, rule out, or any of those suggestive diagnoses, you can code those. The great thing is I like to see, you see that the patient has a symptomatic anemia. It's telling you that his hemoglobin upon admission was 6.8 with a hematocrit of 23.5. Patient to receive a 1 unit of packed red blood cells. Repeat the H&H per protocol. So with that, we know we got to do the anemia, the D6 3.1. And you will have to code the transfusion of the red blood cells if the patient had the transfusion done. Also, it's telling us, like, we'll look at the major depressive disorder. It tells you the medication that the patient is going to continue. So that kind of lets you know it's a chronic condition. The BPH, continual medication, that's a chronic condition. Insomnia, when they say continue, trazodone, that's a chronic condition. And then you have your hyperlipidemia continue as well. And when it says diabetes, acute check, AC, bedtime, and 2 a.m. in the morning, you know that patient is not sleeping, but he gets some great care because they got to come in and check the diabetes, you know, before meals and all of that. Next slide. So how hard is it to transition from outpatient to versus inpatient? Well, that depends on a few factors. Are you certified for the transition? Meaning, have you got your certification or a certification that you can transition to the inpatient side? Typically, most jobs take a CCS. They will take your experience. Some jobs you can get hired at, and they will say, hey, if you get the certification within 6 months of being employed with us, then you can get this position, or we would work with you on it. Did you research the job that you want to check for the desired certifications? I always tell people, when you're looking for specific jobs on Indeed, or if you're on LinkedIn or any of the other job sites, make sure you research to see if you have the desired certification that they're looking for. That is one of the biggest factors. Some jobs will put in the job description that they will give you 6 months to get that certification, and that's absolutely great as well. And do you have a preference of working in-house or remote? Now, everybody wants to be a coder based off of remote work. Typically, a lot of us do work at home. I've been at home for a little bit over close to 15 years. I live in Florida. I came from Memphis, Tennessee. It was so easy. My house sold so fast that I was able to just pick up my computers, me and my husband, because at the time both of us was working at home, and we picked up our computers and moved to Florida. We didn't have to worry about if our job was going to be okay for us to move or anything like that. That's the great part of working remotely. A lot of people don't understand that when you do work remotely, there are productivities that you must do. You also have to sign a form stating on certain rules that you must adhere by when you're working remotely. And some jobs lately have been asking people to work and keep your cameras on your computer so they can monitor you working. Some jobs do that. Also, you have to take pictures of your room that you're working in. I don't have a problem with that because my room looks like an office, but if you're not the way that they expect you to be, you might have to make a change. Bad part about remote working is if your lights go out, you're probably going to have to make that work up later. Whereas if you was in a hospital and the lights went out or something went down or the system went out, they wouldn't make you make that work up. You don't get to talk to as many people. when you're remotely, unless you're chatting with them on the phone, on your computer or whatever system they have you working on. My office is Teams, so I'm able to talk to my coworkers through Teams if they need me or anything. Working in house, you can have all those potlucks, you can talk to your employees, you have buddies you go to lunch with. So it's a lot different. So was it hard for me? I would say it was hard for me, but what I had to learn to do was when I interviewed with a job, I had to tell them exactly what I was looking for, like what my goals were. And I always tell people, tell a job what your goals are. There's a reason they ask you, do you have any questions? Or do you have any concerns? And you should just be honest with them on what you're looking for. My last job, when I started working for Advent Health, I absolutely told them that my goal is to be an inpatient coder. I have my CCS certification, and my ultimate goal is to be an inpatient coder. The great thing that happened, the blessing to me, was when COVID happened, even though a lot of bad things came out of COVID, what my company did was they took the outpatient coders that wanted to be inpatient coders and trained them, and then they hired more outpatient coders. And my director remembered that I wanted to be an inpatient coder when she interviewed me. And she just simply sent me an email and was like, hey, you still want to be an inpatient coder? And I was like, absolutely. And she was like, okay, so let's transition you over. And I was like, okay, and I absolutely love it. It is time consuming. It is a lot of material to learn on the inpatient side, but it's challenging. And my greatest thing is I tell people, if you like to be nosy, then coding is for you, because pretty much we're being nosy in patients' information, and we're telling the insurance company what they need to know in order for the patient to get the proper reimbursement. Next slide. Any questions? Anybody have any questions?
Madeline did ask one question. Japera,
Okay.
did you see that? Are you ready to address Madeline's question?
Yes, I do. I do see Madeline's question. She is asking about, she says she saw some TikTok videos on the CBCS credential, and she didn't see that on the list that you provided, that long list of credentials, but she wants to know, is the CBCS credential useful?
Okay, the CBCS is the Certified Billing Coding Specialist, maybe? Madeline, am I right?
Madeline, you'll have to clear it up for us. Now, unless someone wants to do
I want to make sure.
We'll wait for her to respond, or somebody else might want to do a quick Google search for us so we can cover that quick. Yes, Certified Billing and Coding Specialist. Thank you, Madeline.
Yes, I mean, you can still do certified billing and coding specialist. It's probably not one of the hottest ones out right now that's in the biggest need, but on the outpatient side, you probably could get a really good job working in a physician's office doing the billing and the coding side. But it will be a lot of work. Because typically you want to either do billing or coding, but if you do billing and coding, then you're pretty much taking care of the whole bill side. Maybe for a small office, it would be great, and you probably do really well on that.
Okay, good. And then Kayla is asking, what is a good next role for someone who has been coding inpatient for 5+ years? And she says she's asking for a friend, okay? She's asking for a friend. And they have an RHIA and a CCS credential. What's a good next step? What's a good next role?
It just depends. Typically, when you've been working for 5 years, you kind of know what you like and what you don't like. Like, one of my supervisors asked me, did I want to be an auditor? And I was like, well, I don't like looking at other people's work. So an auditor wouldn't work for me, but it might work for you. Auditing, any other documentation expert positions, If you have your RHIA, you probably could even go into a leadership role, such as a supervisor, a lead, or even a manager, because those are the certifications that they look for. So it just really depends on what you like to do. And you, of course, you know, everyone is different. I don't like auditing. That's just not my thing. I'm like, I don't like to do the double work. But for other people, they love it. So it just depends on what you like and what you think will make you happy in the coding field. It's so open right now that it's your world. You can do so many things with coding.
That's awesome. Okay, so here's another question. Shamira is asking this. Shamira is asking, is it difficult to start an outpatient coding remote position with no experience? But she's asking for a friend too. They have a RHIT credential.
Is it difficult? No. I would say that the biggest problem is everybody thinks that when they become a coder or auditor or whatever in the medical field, they think just because you get your certification, it's going to be easy breezy. It is not easy breezy, because this is I'm gonna say it like my young folks said, up and popping career right now. So everybody likes to code. They see the benefits of coding and notice that it is a good career choice. Not only that, a lot of the RNs, registered nurses, when they leave patient care, they come over to be a coder because they want to just get out the patient care, but they want to still be able to use the medical experience that they have learned over the years. When it comes to outpatient coding, I wouldn't say that it's hard. I would just say that you may have to start, and you could start with medical records and work for 6 months and then get into it, you know, get to talking to the coding person in there, and you might increase that way. You might be able to do HCC coding, which that's where a lot of people are starting at. But I would say you would need to interview, fill out a lot of resumes or a lot of applications for jobs. And I would say that you would need to, when you interview, follow up, because everybody don't think you're going to be the only person applying for that job. I always tell like my students and those that come to me, they say they're looking for careers, that you need to follow up with the person if you're really interested in the job. Even if it's just a simple letter, it could be an email saying thank you for this position. Thank you for the opportunity of the interview. I'm really interested in the job. If I need to come in for a second interview, I am available. That makes you stick out from everybody else.
That's usually a question that we get. A lot of people want to know, especially students that are recent graduates, and you know, they go through the programs, and of course the programs prepare them to take a certification or some type of, you know, certification exam, be it RHIT or RHIA if they're finishing a bachelor's program, or a CCA or CCS. They just run into this wall with not having the experience. So I think you just kind of helped us navigate and comb through that. Is anyone in the audience having or experiencing that right now, or have something that you would like to add to that? Please feel free to drop that in the chat on how people can kind of overcome that barrier. But I think you answered that question very, very well, Trivia. So thank you so much for that. I'm not seeing any other questions in the chat right now.
I see one.
Oh, yes, I do. Yes.
Okay.
It might be Irasima. Irasima says she'll be graduating soon from an HIT program. So what advice do you have for first steps?
First steps would probably be to, when you graduate, go ahead and do your certification. One of the biggest things, or testing, if you are going through a program and you're trying to do your certification, just go ahead and do it. One of the biggest things I see with students that are finishing programs is they feel like they should wait until they go and take their certification And the waiting period is what hinders them because they end up not doing it. So you want to make sure you get your certification. And if you are, whether you're doing, so I'm thinking the HIT program is through AHIMA. So I would say start to talk to or start to get involved in the chapter. So if you're with AHIMA, every AHIMA person has a board. If you're in the Florida location, it just depends on what part of Florida you're in. You want to start talking to those people. More times than none, those people at these boards are managers, they are supervisors, they are employees of a hospital, and they can probably get you some volunteer work. And if you go and volunteer, we'll say 10, 15 hours a week, that is considered experience to help you. And once you finish your certification, you can say you have experience to get in a job. A lot of times we don't utilize the tools that are readily available to us, and most of them are free. AHIMA has, FAHIMA, which is Florida, they have a board that AHIMA people can go to, and you can locally communicate and network with your other like-minded people in your area with the same certifications of you that can give you not only advice, but to help you to get into a position. AAPC has the same thing. They have a board wherever you're living that you can go and talk to someone and network. And more times than not, it is managers, directors, and other employees that are there that can help you to get a job. You just need to network and talk to those.
Awesome. And a lot of great advice is being dropped in the chat as well. So please make sure, audience members, that you take the time to scroll through that chat. There's all kinds of additions to Trivia's advice on starting out, focusing on the experience that you do have. That's very important as well. If you have ROI experience or release of information experience, then speak about that. I think even if you have experience from other industries or other fields, everything that you have can add to and add value to the organization in some kind of way. There's something that we can glean from that. If you worked in a restaurant and you were a waitress or a server, you have customer service experience, you have organizational and prioritization experience, you have all kinds of communication experience, you got all kinds of stuff. So I think that sometimes we may have to pull or dig or look at what our skills are that we've developed from our previous jobs, and then kind of tug that in, or our previous volunteering opportunities, and just kind of throw that in and highlight that stuff as well. Because you do have something, everybody in this audience right now, you do have something that you can add to enhance an organization or a department. So definitely be encouraged. Again, scroll through that chat. There's a lot of feedback coming from your peers, people who are working in the profession and who have experienced what you may be experiencing right now. So take the time to connect. I also want to say, if anyone is willing to, please do drop your LinkedIn link into the chat as well. This is a great opportunity to connect with some like-minded individuals in the profession who can share with you their experiences, or who can help motivate and inspire one another. So please do drop that information in the chat if you're willing to do so. Trivia, anything else you have for us today?
No, that's it. I'm on LinkedIn as well, so feel free to friend me. I'm Trivia Kimbrough. It might be Trivia Holmes in parentheses, Kimbrough. But I did want to say that Herman Dixon did write something that is so critical. Even if you're looking for a job, make sure you keep up-to-date resources on CPT, HCPCS, ICD-10, and all of that, because each job usually does test you to make sure you're proficient before you get the position. That is great. Make sure you just keep up. If you just pretend and play like you're coding something, that is imperative, because you want to be you want to have it together when you go in for that job interview and they offer you to do the job test to make sure that you know how to code HR. But thank you everybody for having me, for listening to me. Follow me on LinkedIn. Thanks again.
This has been awesome. Very, very helpful information. I mean, Trivia, you walked us from the bottom to the top. Okay, you walked us all through the certifications, what kind of experience you need, how much money you might be able to make, you got all kinds of good stuff. So if this information has been good to you, please do drop that in the chat as well and let Trivia know that this information was helpful. We're also going to be sending out a feedback form. So please check your emails for a correspondence from the qualified asking you for some feedback. We want to know how we can even make these events better for you so that your experience is good and so that this hour that you spend with us is worth your while. We love getting presenters from diverse areas of HIM to come in and share with us their expertise and their experience. So there is a lot more to come, everyone. If you're not connected with the qualified already, please make sure that you follow us on all social media outlets. I don't see TikTok on here. We may not be on TikTok yet, but we are on LinkedIn, Facebook, Instagram, and YouTube. Also, if you are interested in sharing some of your expertise with our audience, we are always looking for presenters to present at our Brunch and Learns. And I have an email address down at the bottom of the screen to the right. For me, it's on the right-hand side, events@thequalified.com. So please make sure that if you are able to, that you please do email us if you are interested in presenting at an upcoming Brunch and Learn. Again, we're always looking for folks to share their experience. Now, next month, everybody, next month we have Miss Mariah Hilton joining us on September 21st. That's the third Thursday of the month at 11 o'clock a.m. And Mariah is going to be speaking to us about a roadmap to quality EHR documentation. So she's going to give us some ins and outs on EHR documentation. If you have not registered for that event, please make sure that you do so once that link is published, and always share it with your coworkers, share it with your colleagues, share it with the people in your department, your supervisors. We want to provide these opportunities to as many people as possible. We all need CEUs. So this is one CEU every single month that we are providing. If you want to know anything else about the qualified, go to our website, the-qualified.com, and there will be a wealth of information available for you. Even if you need to go back and look at some of the old CEU events, you have an opportunity to do that as well. Ladies and gentlemen, that's everything that we have for you for today. This has been an outstanding time. Can we give a round of applause to our presenter, Trivia Kimbrough? She has done phenomenal. Thank you so much, Trivia. If I had a little like sound effect in the background, it'll sound like the audience is clapping their hands. I believe everybody's doing that anyway. And so Trivia, thank you for being with us today and for sharing with us. Everyone, we look forward to seeing you next month at our Brunch and Learn on September 21st. Have an outstanding rest of your day. Shine bright, everybody, and keep up the excellent work. We'll see you next time. Bye-bye.
Bye.